Mike King here. Well, goodness, we've had the soft launch of VOA Connect this week. It's been a great week, and thanks to all of you for participating in that, joining in, signing up for it, going to the platform. It's a great way for us to truly connect across the field and across this new platform. We love it. Next week will be the time to sort of go back on the platform and add more detail to your profiles, and at the same time, start connecting with your colleagues. Literally start connecting and signing up for some of these special interest groups, if you will. Various interest groups around what you work on and the things that you are interested in. It's a great way for us to connect, a great way for us to share information across the platform. It'll be terrific for us. As we go forward with this, then we will literally have a official launch, if you will, the official launch of VOA Connect on Founders Day. What a better time to do it, by the way, on Founders Day, on March the 8th. So watch for that. There'll be special activities, literally scavenger hunts, and you name it, all kinds of contests and games and stuff. It'll be fun stuff. So stay tuned and watch for news about that, but that'll be fun. Also, this month of February, is Black History Month. And it's really, really cool this year in that there's this wonderful alignment around our focus on healthy communities. The theme for Black History Month this year is Black Health and Wellness. Black Health and Wellness. Perfect alignment with our own alignment, if you will, within our strategic plan around creating healthy communities. It's the kind of thing that we wish to get better at and do across the board for everyone. For everyone, to see that we are here to serve everyone. And that is so cool for this. So it's perfect alignment with Black History Month. Enjoy the activities related to that as we learn and grow together. Now, just a reflection that I wanted to share with you that kind of reaches back to what we talked about earlier around VOA Connect and the ways for us to connect as individuals and as folks, if you will, within our own family, our Volunteers of America family. I had the chance this past week to serve the first time to really chair as board chair the LeadingAge board, the Board of LeadingAge, which is the association that deals specifically with senior services, if you will. All the folks relating to affordable housing for seniors, as well as senior care, skilled nursing, assisted living, independent living, all those different kinds of things, PACE programs as well, and even community-based services. These are all the folks that are engaged in this. And it was interesting that the most engaged and stimulating part of the discussion that we had as a board was literally when it was not been listed as a scheduled topic. Someone brought up the fatigue level that their staffs and their people are feeling and how it's impacting their lives, impacting decisions they make, literally moving towards some retiring early, resigning, that sort of thing. Talks about ways to intervene there creatively and innovatively, maybe coming up with means of taking sabbaticals instead of having to resign, to take that time out, take that break. And it just let me sort of see again and reflect again that this is something we feel across the entire nonprofit sector. We probably have never seen fatigue levels this high, and they've never been this high among caregivers across any service sector. It's absolutely true within the Volunteers of America family, and it just emphasized to me again that, wow, we have to create as many opportunities as we can for our folks to really touch base with one another. Because the most draining part of this that people talk about is the feeling that they're in this alone. That truly they are in this alone. They are so tired. They're worried about making mistakes, and they are in this alone. We need to create as much opportunity to having listening sessions, sharing sessions, so people can see that they are part of a family and that, yes, your colleague has your back. Your colleague has your back and is there to support you. You can pick up the phone and call, not unlike what we've been doing in our REST program, if you will, to deal with moral distress and moral injury across the sector since the pandemic began. And specifically in those service providing units, if you will, where we literally took it mobile, where you love to do it in person, but if you couldn't, you could do it by phone, do it virtually. Those kinds of things. This is what's most needed right now. And it's the time that really we need to pay attention to this for our folks that are on the line, as well as folks that are managing those who are literally on the line every day. So that's really kind of what I wanted to reflect with you on, is that we need to pay attention to this every day. We need to provide as many opportunities for listening as we can and enable our family, our Volunteers of America family, to feel like we have their back. We have their back. I know all of you are doing this every day, truly doing it every day and saving lives every day. God bless you.